Hello, everyone, and welcome to Triumphs and Tensions of the Telehealth Boom. My name is Carmel Shachar, and I'm the Executive Director of the Petrie-Flom Center for Health Law Policy, Biotechnology, and Bioethics at Harvard Law School. We are delighted to host this event. Telehealth has really been, I think, one of the most interesting areas of healthcare access and delivery over the past year. This is going to be a moderated discussion between our panelists. So we not only welcome audience questions, we strongly encourage them. How can you submit questions, you may be asking? There are two good ways to do that. The first is to use the Zoom Q&A feature. So if you go down towards the bottom of your Zoom screen, you should see a button that says Q&A. Submitting a question that way is really the best way to get the question to us and get the question asked of the panelists. You are also welcome to join the conversation or to submit questions on Twitter using the hashtag telehealthboom. Again, that's hashtag telehealthboom. If you ask a question there, Petrie-Flom staff who will be monitoring it will pull that question and put it into the Zoom queue. Please do not use the little blue raise your hand feature. It's very cute, but we will not be monitoring it. And by that same token, the Zoom chat is not a venue to submit questions. With that, I would like to hand the event over to the real MC of the event, who is Mason Marks, Assistant Professor of Law at Gonzaga University, as well as Fellow in Ethics of Technological and Biomedical Innovation at the Edmund J. Safra and Petrie-Flom Centers of Harvard University. Hi, Mason.
Thank you, Carmel. Welcome, everyone. Good afternoon, good morning, depending on where you're calling in from. Thank you for joining us. I want to thank some of our Petrie-Flom staff, especially Laura Chong and Chloe Reichel, for their contributions to this event. We have a great panel of experts with us today. We're joined by Tara Sklar, Professor of Health Law and Director of the Health Law and Policy Program at the University of Arizona James E. Rogers College of Law. We're joined by April Mims, Vice President of Public Policy at Hims & Hers Health, Inc. And we're grateful to have Laura C. Hoffman with us, Senior Research Fellow at the Solomon Center for Health Law and Policy at Yale Law School. And we're fortunate to have Blake Reed with us today, Clinical Professor at the University of Colorado School of Law, Director of the Samuelson Glushko Technology Law and Policy Clinic, and Faculty Director of the Silicon Flatiron Center in Boulder, Colorado. Telehealth is a fairly broad category. It really boils down to healthcare being provided at a distance. And that could encompass everything from a doctor having a virtual appointment with a patient by phone or over Zoom, to smartphone apps that provide text-based therapy to patients or employees, and even artificial intelligence-based chatbots that dispense medical advice. Telehealth could involve doctors providing care to patients across state lines or national borders, or even someone on Earth providing care to astronauts on a space station. And communications over telehealth need not occur in real time. They can occur asynchronously. But regardless of how we define it, prior to the COVID-19 pandemic, telehealth might best be described as kind of a fringe technology. There were significant limitations on what could be done by telehealth. Access was often limited by the cost and quality. There were limited options available to practitioners who wished to take their services online. Some types of care were restricted, and there were limited options for reimbursement for services by insurance companies. 1 year later, the COVID-19 pandemic has created a telehealth boom. In the past 12 months, there's been an explosion of providers and technology platforms. Certain regulatory restrictions have been relaxed, and there are more and more options for patients seeking care by telehealth, both in terms of the types of care they can receive and the people who can deliver that care. In this panel, we'll discuss some of the triumphs of this telehealth boom, but we'll also delve into the tensions. Delivering care by telehealth can potentially reduce the quality of care, and in many cases, it should not be a replacement for in-person care. Patient privacy may be compromised as technology platforms increasingly become intermediaries between patients and providers. And though telehealth can increase access to care for many people in rural areas, for example, it can also create barriers to access for some populations, such as seniors, people with fewer resources, and people with disabilities. Hopefully, through this discussion, we can help highlight these areas of promise and concern to chart a path forward that promotes better health for everyone. With that, I will turn things over to our panelists. I'd like to give each panelist an opportunity to speak for a minute or two about anything I might have missed during the introductions, and to tell us what they find most promising and or concerning about the telehealth boom. And I'll start with Tara and then move to April. Tara?
Great, thank you. And thank you, Professor Marks, for just bringing this panel idea to fruition and inviting all of us here today. Also, thank you to the Petrie-Flom Center, to Carmel, Chloe, and Laura, all your support. And I do want to add all your support for all the virtual events you've had all year. It's been just tremendous. And to my co-panelists, I've really enjoyed how our different expertise and interests have intersected in this area of telehealth. It's almost like a Venn diagram where we'll have telehealth and digital health technologies in the middle, and then my area is more on older adults and aging, Professor Hoffman, disability, and Blake more on the tech and privacy security side, and of course April with the very important growth and interest of what's happening in the private sector. So I think it's just a great intersection of ideas in terms of how we're approaching this expanding area in healthcare. I hope to discuss today to shed light on some areas that aren't as covered as frequently in the literature and by the media, specifically about older adults and long-term care using telehealth and digital health technologies. You know, I view it as a way to help increase high quality, safe, and accessible care for older adults. And I think that what's really happened since prior to the public health emergency is we saw that in February of last year, less than 1% of Medicare beneficiaries used telehealth for primary care visits, and this number increased to nearly half by April. We've seen a 300% increase among seniors in general for telehealth services. So huge growth and interest, which highlights all kinds of interesting issues about access and pent-up demand and what may happen going forward. The areas that I'd like to talk about the potential tensions or as tech continues to increase, we do know that loneliness and social isolation is much more prevalent among older adults. And I think that's particularly concerning coming out of a year of COVID, where we've all taken precautions to be socially distant, especially among older adults. As we're proposing, you know, having more of these tech devices in the home, delivering telehealth from the home, what are some of the safeguards that can really benefit an older population, both to protect their privacy in terms of the types of information they want to have disclosed about them, what they consent to, but also a very strong issue among older adults is neglect and abuse and exploitation. How could telehealth potentially act as a safeguard to prevent some of that and make it stronger in terms of what a provider might be seeing in someone's environment and with their overall vital signs going forward? I think that the major issue we're seeing with telehealth is also with with older adults in general, long-term care, is chronic staffing problems. And what's very common in the literature is this digital divide. And I would propose to add to that, that certainly relates to reorienting staffing around long-term care with how to better deliver telehealth along with training and resources. So mostly, I just want to thank you for the timely topic. It's really a defining moment, both because of the promises and all of the tensions and shortfalls that we'll discuss, and also what could happen after the public health emergency ends. So thank you, pleasure to be here.
Thank you. April?
Good morning from the West Coast. April Mims, I'm Vice President of Public Policy at HIMSS and HERS. Like Tara, I'm very excited to be here today. Thank you so much, Mason, for organizing this panel, and to the Petrie-Flom Center for putting this together. Just to tell you a little bit about the company that I represent, Hims and Hers is a direct-to-consumer telehealth and wellness platform with a mission to eliminate stigmas and make it easier for people to access quality care and improve their lives. So we started about 3 years ago with a very specialized approach, really focused on sexual health, skincare, and hair loss. And as others have already identified, because of the pandemic, we've really had this opportunity to step up and ramp up. And now we also provide primary care. We provide home-based COVID saliva-based test kits. And then we also have a behavioral health platform that we are continuing to build out that I'm very excited about. In my role, I work with a lot of policymakers. So I spend my time kind of introducing the company to folks, helping them understand what our mission is, and then really working to increase access to care and to support policy that's going to make it more easier for people to access the technology, taking what we call a mode neutral approach. And so I hope to have a broader discussion, about the different ways in which we can access this technology and what the benefits are to it. In terms of what I think some of the most important things to touch on with respect to telehealth, obviously I'm going to be more of an enthusiast when it comes to what the potential is here, but I think the opportunity to provide quality care is immense. I think customer satisfaction is one way in which we measure quality. And on our side, we've recently, we conduct surveys of our customers and they're extremely happy with their experience. We also know that from our experience in our surveying, only about 34% of them are actually satisfied with traditional care. So through our platform, because we're direct to consumer, we really have the opportunity to connect directly with the patient. We avoid some of the guardrails and the gatekeepers traditionally of healthcare. Another interesting thing about us is that we are a cash-based platform. So some of the friction around payment, we also don't have to work with. And so I think the potential from our perspective is that you get a really straightforward approach to care. It's affordable because we try and provide a low rate to people. And then it's also easy to use. We've created our own electronic medical record. And so just to touch on quality, I think with telehealth in general, there's also an opportunity to really leverage technology to the benefit of the patient, whether it's providing tools to prevent fraud and to increase identity verification, or also, using technology to be able to point out ways in which people might try and game the system. So we can use technologies and create redundancies in our questions to make sure that somebody who's trying to utilize the system in an inappropriate way, we can call that out. We can also use the technology to point out for providers when it might make more sense for a patient to be referred out for in-person care. So really, when all of these tools are working together, you get a really, a quality experience. I also very briefly wanted to touch on the importance of accessibility. This is something that's important to me personally and very important to Hims and Hers. And so as we know, telehealth has so much promise, but unless we can really make all of these tools accessible to more people, we're not going to fully deliver on the promise of telehealth. And that's something that our company is really focused on and that we've partnered with over 100 different organizations to look into this topic. So excited to delve into issues like the digital divide, talk about digital literacy and all of the ways in which we can make sure that these important technologies are getting into the hands of more people so that they can have higher quality care.
Thanks, April. Laura?
Thank you so much, Mason. And thank you to the Petrie-Flom Center staff, Carmel, your leadership, Chloe and Laura for all of the help with the logistics and the blog, and especially Mason for assembling such an extraordinary panel that I'm so honored to be a part of. So my scholarship has primarily focused on vulnerable populations, in particular people with disabilities and children. My primary concern as far as telehealth moving forward is ensuring accessibility for our vulnerable populations. And I focus primarily on disability, and I feel that through looking at the lens of disability, we can honestly see a lot of these issues more clearly and also benefit more of these populations than just the disabled population. And so I look forward to discussing many of those accessibility issues further as we go through the discussion. But from my standpoint, telehealth will be as successful as it is accessible to our most vulnerable populations, or else we have the potential to end up with creating a doubling of healthcare disparities in the United States if we don't properly address those needs. The second point I'll just make quickly is thinking about policy moving forward. As we know, right now, states throughout the country are considering telehealth policies, while we also have policies being considered on the federal level. So I think we really have to think about what we want to see as far as this division of policy. Do we need certain issues to be addressed by the federal government to provide more consistency in our telehealth policy? For example, looking at privacy concerns especially. But I think we do have to have more of a conversation about where we go in terms of policy and what role the national legal place is for telehealth and how that's going to be addressed federally as well as on the state level. And I am delighted to have these conversations with this panel and beyond. Thank you.
Thank you, Laura. Blake?
Thanks, Mason, and echo all the thanks to you and the Petrie-Flom Center and staff and to all of my co-panelists. What a wonderful discussion. Really looking forward to getting into it today. So I'll just build off of what Professor Hoffman had to say there, and say my focus has been on the accessibility of telehealth platforms, particularly for people with hearing and speech disabilities. And I think, you know, one brief point to make here is that, as is often the case with accessibility, technology both giveth and taketh away. And I think going from telehealth being sort of a curiosity, or Mason, I can't remember if I'm using the exact term that you started us off with, but being maybe kind of a fringe thing that is not used that frequently, to suddenly being overnight the primary modality for the delivery of care. And obviously we can talk about different, you know, modalities within telehealth, whether we're talking about video conferencing or telephone calls or what have you. And so there are lots of disability communities for whom increased access via telehealth and sort of the normalization of telehealth is a huge boon, right? Because where travel to a doctor's office or travel to a healthcare facility previously was a huge burden and difficult, suddenly you know, that distance is overcome in a much easier, much less expensive and much less burdensome way. The experience, of course, for people with hearing and speech disabilities has been a little bit on the other side of the fence, where suddenly the expectation is that these telehealth platforms, which haven't really been all that road tested, become the main way in which you communicate with your doctor, and they have no way to accommodate, bring a relay operator on board, to have somebody do sign language in the middle, or to incorporate a captioner, or to make sure that the user interfaces are accessible with screen readers for the blind and visually impaired community. And so suddenly we had a lot of this kind of fringe technology roll out in a way that you know, it wasn't fringe anymore, and it hadn't really been, like I say, kind of road tested or our accessibility ensured. And that's led to a real sense of urgency in figuring out, how do we get these platforms to be accessible? What are the right legal frameworks to do that? Do we look at it through the lens of traditional disability law that might govern a place of public accommodation like a doctor's office? Do we look at it through the lens of telecommunications law, because we're talking about video conferencing? What do we make of all of this? And it's happened in a really difficult environment. So look forward to unpacking that and all of the other issues today. Thanks for having me.
Thanks for joining us. I'm very interested in this kind of tension between accessibility and the lack of accessibility, and I think we might as well just dive into that. You know, what are some, how can this technology both increase accessibility and decrease it for some, and what can we do about it? Do we need federal regulation? Is this something for the states to address? And then we had a question from Chloe that I also want to throw in there, and if you have questions, please by all means use that Q&A feature. But is there a risk that this very rapid adoption of telehealth might start to blur the lines between telehealth and concierge medicine, such that it will become kind of an exclusive way to access care, perhaps the only way to access care, and other people might be kind of left out. How can we prevent that from happening? Anyone can just jump in on that. Feel free to jump in or raise your hand.
Can I say something, Mason?
Please.
Oh, yeah, I just wanted to touch on accessibility as far as websites and apps for people with disabilities. And, you know, we already know that there's a lot of accessibility issues, as Blake was mentioning, but the website accessibility issue is huge right now because we've had, you know, the ADA, which was, you know, created in 1990 before the internet and before we had all these technologies. And despite the fact that the legislative history of the ADA supports the protection for people with disabilities there, we've had a stream of cases that have, you know, been split in terms of website accessibility. And because of that, you know, you might have accessibility one place, but not necessarily other if you go to court. And at this point, we haven't had the Department of Justice come through with the guidance to say this is what website accessibility requires. And I just feel like that is such a major roadblock right now for people with disabilities and ensuring that they can access this technology. And this comes in where, as Blake mentioned, you know, assistive technologies for people. People like myself, I am visually impaired. I have a text enlargement program on my screen right now, but some people's you know, assistive technology may not be compatible with the websites, and because of the accessibility. So we need to do something to fix this issue, to ensure that people you know, have access to the websites and the apps to be able to just be able to use the telehealth.
Mason, I'll chime in just really quickly to add. I think we have a new question about how to allocate responsibility here. So when we think about healthcare delivered not as telehealth, but in person, it's been a fairly uncontroversial proposition for a long time that we would impose responsibility for ensuring the accessibility of care, and it might be through the physical building, making sure that entrances are accessible, making sure the facilities are kind of physically accessible, or it might be through the provision of interpreters in person, or it might be through the provision of cart services, or you can imagine the sort of panoply of other things that we might do in person. But that's pretty uncontroversially been the responsibility of a healthcare provider to come up with a program for doing that. When we introduce telehealth, suddenly we have healthcare providers using a third-party platform, a video conferencing platform. It might be something proprietary that they deploy an instance of locally. It might be a cloud-based service, but they might not have as much control over it. And so we suddenly have questions about, well, what part of the accessibility responsibility falls on the doctor's office, and what part of it falls on the platform, and maybe what part of it falls on the federal government. So obviously one concern we've heard a lot of is, how do we make the telehealth compatible with the relay system, right? How do we incorporate a relay operator into it, which is something that the FCC administers out of the relay fund. So suddenly we've got these multiple nodes of potential responsibility, and you know, and in the best of circumstances that we would need to have some coordination between, and we have very little of that coordination happening, and very little sort of force to push folks to coordinate with each other. So we've replaced a fairly certain legal regime with a fairly uncertain one, and I think that's part of our problem here.
I'm happy to jump in here too. You know, from my perspective, kind of working with policymakers, particularly at the state level, I think there are a lot of regulatory barriers in place that are actually preventing more access to care. And so I'm sure many of us here are familiar with the like 1834M kind of requirements under the federal law that have restrictions, you know, around originating site requirements, you know, where people can deliver care, where providers can provide care, what modalities can be utilized and reimbursed. And so, from our perspective, when we think about things, we primarily focus at the state level. We think about, how can we provide a definition of telehealth that makes it able for providers and patients to connect. As long as the provider is meeting the standard of care, we need to increase flexibility there. From my perspective, I'm really thinking about rural communities, urban communities, communities that have been, because of the digital divide and also systemic barriers, haven't had as much access to care. How can we get that technology into the hands of more people? And, on our platform, we utilize something that's called asynchronous modality. And that's basically a visit that's not in real time. Not only is that convenient for the patient and for the provider, but we've also found that there's an equity component to it too. If you do not have high-speed broadband, there is a way in which you might be able to utilize this type of visit to be able to get care from your home. If you're a person that doesn't have a lot of flexibility in your schedule, this is a way that you can see a provider without having to take time off of work or look for childcare, or frankly, just find a quiet place to have a visit. And so I think from a regulatory perspective, a lot of times we hear pushback in terms of quality or safety with respect to exploring different modalities. And certainly that's something that's paramount to us, is making sure that we have quality platforms and quality care that we're providing to all of our patients. But I think the answer is not to provide a number of new restrictions as it relates to the definition of telehealth, because what we find is that when we create those restrictions, the people that suffer the most are the ones that don't have as much access to the technology. They don't have the ability to go somewhere else to get care. They don't have access to in-person services. We even see requirements at the state level that require in-person care prior to being able to perform a telehealth visit. When you think about the ability of telehealth to be able to access more communities, having an in-person requirement is a huge barrier to entry. And so, certainly I'm looking forward to learning more from this panel about, what some of the deficits are, what some of the things are that we need to work on, both as a telehealth company and as regulators. But I also think on the policy side, we need to make sure that we are also creating definitions that allow for platforms to be creative and innovative so that we can expand access as well.
Great. Well, I will follow up with all these great comments, suggestions, and points. I think what might be helpful in this transition is to just take a step back and think about where we were a year ago with how telehealth was utilized, which was really basic. It was like these one-off appointments. You didn't know the provider. It was either providers talking to specialists. It didn't involve the patient. To think about how far we've come in a very short period of time, so it's expected that we're going to have these gaps and questions and ways to make it more optimal. And that's why I'm proposing more of an idea of phasing in how we incorporate telehealth with the current standard of care. And I think the main way to do that from a policy legislative perspective is through reimbursement, particularly with community health centers, which I think are having a real issue with upscaling, both with actual tech devices and resources and internet, as well as training their personnel. So I would say, let's think about the whole model, and let's have some of both those in the community health center space, take on other roles as care coordination, patient navigators, those involved in the shared decision-making around telehealth and what's involved. Also, we have 50 million unpaid caregivers that are often responsible for helping loved ones show up to those appointments that could be very hard to navigate, especially if we're coming from a rural area, and how to incorporate them in this model. And so like one thing that's on the table right now, sure April is well aware of this, is Biden's infrastructure plan, which includes $400 billion to support home health care. And that could be a great move forward to increase accessibility for vulnerable populations in ways that would, I think, be very meaningful. Regarding the websites and assistive technology, I think it's fascinating. I think it could actually be a real opportunity if it is done appropriately to really help those with sensory deficits, particularly if there is closed captioning, if there is the opportunity for other ways to particularly hear or see a provider that you can't even always get from an in-person visit, how to optimize our way of interacting. I think it'd be really quite promising. this is a side note that I spent at least a year with my an older family member, where the only way I could communicate with him was through a Bluetooth device in his ear. Otherwise he couldn't hear me. So, and he had hearing aids. It was just that device was so much more powerful. And I think that is something to consider with how the standard of care right now does fall short for accessibility and quality, and what we can do going forward with telehealth.
Thank you. I want to ask all of you about choice and how important you think choice is in telehealth. You know, previously, before telehealth, if you went to see your doctor, you wouldn't have any choice over what type of electronic medical record they use or other software they use in their office. And that seems to be increasingly the case, at least just in my kind of, research into this area. It seems like a provider will choose a particular telehealth platform, a particular company. It may involve a particular modality, a voice, a video conference, for example. How important is it that patients be able to have some flexibility in both the modality, perhaps the company that provides that service, and how, are there any ways we might create that flexibility for patients?
I'm happy to kick it off. I mean, obviously I'm going to be enthusiastic about this particular question. I think that choice is one of the biggest benefits that telehealth provides us. On our platform in particular, we work with a lot of, younger millennials, Gen Zers, and what we're finding through our studies and surveys of them is, many of them don't have a primary care provider. They're not accessing the traditional healthcare system. And a lot of times that has to do with lack of choice and stigma. And so I think one of the benefits that telehealth does provide is you have that ability to access specialty care. You don't have to necessarily go through your primary care provider and get referred out. If you live in a community that doesn't have access to these in-person services, using these type of telehealth platforms, you can instantly be connected to somebody that can provide that type of specialty care. And then I also think, to your point, Mason, in terms of choice for providers and what type of technology they want to use, what type of software they want to use. There are a lot of opportunities there as well. With respect to asynchronous modality, one of the things that we learned through a study that we did, we didn't do it, but it was commissioned by Accenture, is that with respect to behavioral health, especially millennials and younger folks, about 76% of them are wanting to utilize non-audio visual ways to connect with folks. And some of that has to do with the stigma. Before the pandemic, and I think before telehealth was on this rise, you could see a world where somebody chose not to access any care because they didn't have those opportunities available. So I think with respect to technology, software choice, telehealth definitely provides a lot of promise. And then the last thing I'll say is with respect to providers. So provider diversity is also a great benefit of telehealth potentially. So to be able to access a provider somewhere else in the state is important for folks, especially as we think about behavioral health. As a woman of color, maybe I want to make sure that my provider is a woman of color. If I'm a part of the LGBTQIA plus community, if I'm a member of, a community that has special needs, I want to make sure that I have providers that understand, that can sympathize, and that can provide care in a way that is best for me. And so ideally, when telehealth is accessible to all, it's providing that choice for more people.
So I'll chime in real quick and say, I think from an accessibility perspective, choice is huge, right? The right combination of accessibility features is going to vary pretty widely from community to community and person to person. Thinking about asynchronous modalities too, we hear a lot from the deaf-blind community, for example, and trying to think about how real-time solutions might not be ideally suited to the kinds of communications that you want to have there. I think the challenge about choice is, where do you position that choice, right? Who is in the position of facilitating that choice? at least from my perspective as a patient, you know, that I don't get a lot of choice, right? I get an employer provided healthcare network that dictates a particular facility that I go to, and a particular set of doctors from whom I can choose. And the telehealth platforms that they provide are provided to them. And the experience I have with my doctors is they are, who are super lovely people, they're not technologists, right? And they don't perceive themselves as working for a tech company, right? And so I often see a lot of frustration from doctors about the telehealth platform. I'm sure many folks have had the experience of being on a telehealth call where it's not really working for anybody involved, right? And so I think, where does that choice get levered into being? I think for a lot of healthcare providers, the person who is making the decision about the platform is many steps removed, either from patients or from doctors. So, you know, I think we're backing into, when we talk about choice, broader sets of challenges about how the healthcare industry is structured. But I think we should remember that we shouldn't expect technology companies to be experts at healthcare, and we shouldn't expect doctors to be experts at technology. And so figuring out how to bridge those gaps between them is probably something that we need a whole new class of entities, a whole new class of providers to sort of bridge those gaps and facilitate that kind of choice. And I don't think we are anywhere close to having that yet.
I just want to jump in on something you said there, Blake, about how we shouldn't expect the technology companies to be healthcare providers and the healthcare providers to be tech people. And that's a distinction I'm very interested in, because a lot of times we see this in the Uber, gig economy situation, where Uber will say, we're not a transportation company, we're a tech company, or Airbnb will say, we're not in the hotel or housing industry, we're a tech company. That concerns me in the healthcare space, right? Because we have these tech companies increasingly acting like healthcare providers, but claiming to be tech companies. How do you all view that distinction? Do we want that separation there, or do we want to hold tech companies, accountable the same way we might providers? And how do you see that playing into this telehealth boom?
Tara, Laura, does either of you want to come in on that? I have thoughts, but I don't want to steal the floor here.
I just want to add, I think it's a great question and point now going forward. And, and everything's getting sort of intermixed, especially with online prescribing, which is where Laura might want to really chime in. And just sort of the faith and trust that patients want to have in their healthcare system with their doctor, and how, if it becomes too commercial or too tech focused, what that could mean for accessing appointments and health outcomes, how that will be perceived. So maybe I'll just draw some more red flags that I see with it, more than solutions.
Yeah, thanks, Blake. I'll chime in as well. I mean, I was just reading an article a day or so ago, and it was written by a doctor, basically, saying we are in the place where we have to start preparing doctors. This is now. This is not going away, the use of telehealth, and we have to start preparing our doctors for this, meaning in medical schools, we have to start, teaching our med students to use telehealth, and also not only just the technology, but how does that transform, for example, the patient provider relationship? What does it mean to have that relationship when you're doing it virtually as opposed to being in person? So I think we are at a very dynamic time in terms of what that means. It was very interesting to read a medical professional's perspective on this, just saying, like, we are here, we need to, prepare ourselves to make that transition now and be helping each other through that. My perspective is that, telehealth is not supposed to replace, the complete in-person care. I've always viewed telehealth as a supplement. Back to something we were talking about in terms of modes of telehealth being available. I mean, I have been in favor of audio only telehealth, because there are populations for whom that can benefit, especially those who are in the digital divide, who can't, you know, afford the smartphone or the tablet, but can use a flip phone to have a telehealth encounter with a medical professional. So I don't think that we should limit telehealth to one particular modality when we could have more modalities that can benefit more of our populations.
I just chime in and agree. I mean, I think there's a notion of just as legal professionals have had to embrace technologies in ways that sometimes make us uncomfortable, right? This is something that medical professionals will have to uptake, and will have to uptake into medical education, and thinking about how do we integrate a telehealth as part of the suite of services that we offer. Obviously, some of that is going to be driven organically, but Mason, to your point, I think we have to be careful on the other side, right? Because all the companies that you mentioned, you're thinking about Uber, or you're thinking about the other sort of, I hate using that term, gig economy, or I mean, a lot of those companies are extremely extractive, right? They've come into a space, basically, you know, garner a foothold in an existing industry by sort of flouting regulations, and to the tremendous harm of people, right? If we want to talk about the disruption that Uber has caused to folks with disabilities trying to seek transportation by basically just ignoring their obligations under the ADA. I think there's a real risk of that sort of thing happening in the healthcare industry, where folks come in and say, gee, doctors and healthcare centers are stumbling all over themselves to figure out a telehealth solution. Let's grab something. If you can be the person that's sort of there to provide the answer to that question, and you're not up to speed on whether it's accessibility, or we haven't talked much today about privacy or security or whatever else, whatever sort of shortcuts you can take, you can really take advantage of that situation. And I think we've seen a lot of tech companies do that in a lot of other industries. Education to be another one. So I think that's a place where we really, I think you're right to point out that we really need to be careful and say, if tech companies want to contribute to this space, they need to be cognizant of and sympathetic to the set of values that underpin the existing regulatory regime, even if it, you know, is not as cutting edge or embracing of cutting edge features as they might like.
I just wanted to jump in here and just add that, yeah, I absolutely agree that it's important for technology companies to, you know, work with regulators, to work with policymakers. I have my own team that's dedicated to making sure that we are collaborating, that making sure that we are following the laws, making sure that we are complying with the existing state and federal laws. At the same time, I think it's also important to point out the benefits that technology is providing, and the fact that we are responding to what patients, what customers, whatever you want to call them, are asking for. So when we do our surveys, what we're hearing is that people are not interacting with the traditional healthcare system. And so the answer is not for us to shut the door on technology, when this is the way that other generations, people who feel stigmatized, people who do not have access to in-person care, are finding ways to connect. I know that there's always a lot of pushback against the rideshare industry, but I would say, but I'm sure every one of us on this Zoom has utilized rideshare at some time. And we know that it's used a lot of times in places where there are deserts and people don't have access to transportation, and that it's providing ways to connect folks who may have other impairments, but using the application can now connect and don't have to necessarily hail a cab, which have had implications for communities that have been discriminated against. So I say that to say that, you know, I think we have to think about healthcare the same way we think about other industries, as part of an ecosystem, and different companies and platforms have a role to play. And there are ways in which they can utilize technologies to fill in gaps that weren't there before. They need to make sure that they're absolutely complying with the laws, you know, following the regulatory framework. But if the answer is not to shut down the technology, because there's a reason it's out there, there's a reason that people are utilizing the technology, it's because it's working and it's filling a gap that was there prior.
Well, I don't think anyone's implying that it should be shut down. I think we're well aware of its important need in place. And I think we're also well aware that we're not just talking about healthcare or rideshare. Like bricks and mortar are becoming a thing of the past, like in every industry, in restaurants and retail, grocery stores. So I think the question more is, what are the appropriate safeguards and that we can do to have optimal care?
Let's talk about some of those safeguards. I want to touch on privacy as well, but we're you know, in the limited time we have left. But what are some of the regulatory changes that occurred during COVID, the COVID pandemic, that made access to telehealth easier, and which of those should we keep after the pandemic subsides, and which of those should we reject? And on privacy, one of those changes was some relaxation around HIPAA requirements, allowing doctors to communicate with patients over platforms that are not necessarily HIPAA compliant. So that might be a good place to get started. There are also some changes around licensing and potentially being able to access care from someone from a different state. Are these changes that we want to keep moving forward, or should we be careful to change them after the risk, is reduced?
I think there's a lot of momentum, both at the federal and state level, to make these changes permanent. I certainly, regarding reimbursement, I think is a key one to look at, because there is a lot of infrastructure that needs to be developed as telehealth becomes more of a reality, and to not have that certainty for different hospitals, community health centers, providers to invest in telehealth in a really quality way is key. So a lot of that came under CMS, with Medicare relaxing or expanding on the services that could be available and reimbursed at parity for telemedicine, and including where you could access it from, which would be that originating site, which could be in the home, which I think love to hear Laura's thoughts on this too, but it has tremendous implications for homebound older adults and disabled individuals. So I think of the many relaxed regulations that have been proposed, those are two that I think have real implications for access going forward.
Yeah, I would agree. I think the pandemic and the relaxing of a lot of these waivers have really forced a conversation about the extent to which a lot of these regulations are in place to protect safety or to provide unnecessary guardrails. And so I think, the relaxing of some of those standards with respect to different modes that can be reimbursed, some of the geographic site restrictions are really important. And also for us to take a look at, licensing to make sure that we are obviously protecting and creating a high standard of care, but if there are ways in which providers in other states, or even different types of providers other than physicians, can provide care through telehealth, that we should explore that. That's something that's important to us as a platform. That's something that we hear from the providers that we work with on our platform, and from patients as well. I think the underpinning thing that we've all touched on, even if we come at this from different perspectives, is that we do have issues with our healthcare system, and it's not just relaxing some waivers are not necessarily going to fix everything. We have a system where a lot of times care is mostly dictated by payers and by policymakers, and the people that are getting left out of it are potentially the patients, and the end consumer. Especially with healthcare, there are a lot of barriers to actually getting that person's feedback. And so that needs to, in order to be able to better understand how we can provide higher quality care, we need to take a look at how can we make sure that the end user is best getting served. And I feel like, especially with healthcare, there's just a lot of intermediaries to getting to that. So that's just something that I wanted to offer as well.
And maybe a more general theme to riff off there is, as we go through these kind of barriers to rolling out telehealth and start to examine our existing regulatory structures, we probably notice a lot of problems that predated the telehealth boom, right? And this is not the first context in which some new technological phenomenon has come along and sort of been a catalyst for like, gee, this is a really bizarre way to structure an industry, and maybe we should reconsider some fundamentals about it. And telehealth is kind of giving us an excuse to do it. I think on the other hand, you know, we have to be wary of sweeping the whole regulatory regime in with that. I think about privacy as a good example there. Or I found that pretty horrifying to just say, well, in the name of facilitating telehealth, like, never mind HIPAA, like, you know, it's more important. And this is actually a situation we run into in accessibility all the time, where we sort of say like, privacy is really important to people with disabilities, right? Professor Dorfman, Mason, you're my colleague, has written a lot about this. Super important. Accessibility is often more important than that, right? And so when we face this, when we get the sort of policy choice framed as, well, do you want to have telehealth or do you want to have privacy? Most people are going to say, gee, in the middle of this pandemic, I'm going to take telehealth. It would be great if we had an approach that took both of those values seriously and said, we really would like to have telehealth. We really would like it to be implemented in a way that respects patient privacy, given the incredibly sensitive data that's being generated, shared, stored, and further disseminated down the line. It really should be accessible. We need to make lots of structural changes to make that work. And I think we're at this moment now where we're kind of approaching maybe the end of the boom, and we're sort of saying, welp, we waived all these rules. Things have not been super great, but now telehealth is here to stay. Like, let's roll ahead. And the thing I'm kind of like waving my hands about is like, okay, but now it's time for us to figure out how to build privacy into these systems, how to build accessibility into these systems, how to build security into these systems, because the further away we get from this moment, the harder it is to go back and add privacy, security, accessibility into those systems. And then we end up leaving communities behind, leaving consumers behind in ways that we were hoping to avoid.
I want to just touch quickly on privacy as our last topic. What are some of the concerns here? Are there any benefits to privacy of using telehealth? And what are some of the risks that concern you?
Oh, can I start? I think that's a topic because there was this survey done out of the University of Michigan on older adults and why they were reluctant to use telehealth. And one of the issues that came up was privacy. This is pre-pandemic, and it was fairly split in the response, where some felt it could be more private to have this, you know, in their own home, sharing with them potential concerns about cognitive impairment or ability, potential incoherency, things like that, that they felt much more comfortable expressing in their home. But then conversely, there was a real fear that this information would be recorded and used again in a way that they had not given consent to. We haven't actually talked about consent too much either, which ties closely to this. But so I thought that was so interesting, and that there was like on this one topic by the same person, they could say, oh, I think it could be very desirable to use this platform to support privacy from a perspective, and as opposed to being in a clinician's office with your caregiver next to you, who or maybe they'd be dismissed, but it wouldn't feel very private. It would feel like you had a very short period of time. You couldn't perhaps express what you would like to. And I do want to say the other issue that's specific to older adults and privacy is that there is a real fear, especially with this continuous monitoring technology that's so much related to how care may be delivered in conjunction with telehealth, that they could potentially have issues of being declared incompetent, where their financial and medical decision-making power could be taken away from them. Real fear about potential abuse or exploitation. And so there are some concerns of privacy specific to an older population where I think that needs to be taken into account beyond the traditional HIPAA and other statutes.
I don't want to cut anyone off here, but we're running a little low on time. So I want to ask each of you to kind of give your tweet length, statement on what you think is most important going forward. What are you most excited about or concerned about for the future in just a few sentences? 140 characters, something like that, 280, I don't know. Anyone want to volunteer to their thoughts?
I would say as my closing statement.
I was going to say, don't make me call on you.
Yeah. I think telehealth and the technology around telehealth has tremendous power to provide a quality experience, one that is safe and one that is accessible and really responding to what the patient wants. We have to make sure that it's accessible. In order to deliver on the promise of telehealth, we have to make sure that we're able to access as many communities as possible. And that means working with the academic community as well as policymakers, nonprofits, hospital systems. It's really going to require a village for us to tackle this new environment that we're in. But I'm optimistic about the future of telehealth.
Thank you, April.
Very quickly, I'll say I think it's important to think beyond access, that this is an opportunity to demand better, more personalized care going forward, including long-term care in that continuum. 140 characters.
Thank you.
I just want to retweet Tara there and say, seize the moment that this telehealth boom is giving us, and make sure that the healthcare system, and not just telehealth, works better for everyone, and including people especially that are not currently well served by it.
Thank you, Blake.
I'm ready, Mason.
Go ahead.
Thanks. I mean, I guess I'm terrible at trying to keep my tweets short, but I'll try. But basically, that we don't leave people behind in deciding how we move forward with telehealth, and ensuring that our policy takes into consideration these issues. Because, I've heard people say, well, telehealth is only going to be for the affluent and the privileged, but we have the opportunity in this moment to make sure that that doesn't happen when we consider our most vulnerable populations, our elderly, the disabled, people of racial minorities, low income, people living in rural areas. If we make sure that we are considering all of these groups when we are thinking about how we are going to move telehealth forward and its policy making, then telehealth will truly be successful, and so will the healthcare of our people.
Thank you so much. I want to thank all of our panelists for joining us today, and all of our attendees. You've given us a lot to think about. There's no way we could cover everything in an hour. So I hope that this is just the start of a much longer conversation. I look forward to engaging with you in the future. Thanks to the Petrie-Flom Center. Have a great day, everybody. Take care.
Yeah.